Ever wondered if a heart can truly break from emotional stress or loss? Does the phrase, dying of a broken heart, have a literal meaning? Let's delve into the concept of broken heart syndrome, also known as Takotsubo cardiomyopathy. Contrary to popular belief, it's not just a metaphor. It's a genuine medical condition, triggered by intense emotional or physical stress. So when we talk about a broken heart, we're not merely waxing poetic. So yes, a heart can indeed break from emotional distress, but how does this happen? Broken heart syndrome is not a heart attack, but it can certainly feel like one. This condition, also known as Takotsubo cardiomyopathy, presents itself with symptoms similar to a heart attack, including chest pain and shortness of breath. But what exactly causes broken heart syndrome? The culprit is often severe emotional or physical stress, which can be triggered by anything from a major life event to a sudden illness. When this stress strikes, the heart's main pumping chamber, or the left ventricle, changes shape. Instead of its usual rounded form, it balloons out, resembling a takotsubo, a Japanese pot used for trapping octopuses. This distortion leads to less effective pumping, which can cause a range of health complications. It's important to note that broken heart syndrome can occur at any age. However, it is most commonly seen in women over the age of 50. Despite the severity of the symptoms and the immediate concern it raises, the good news is that broken heart syndrome is usually temporary and reversible with proper care and management. So, while it can be a frightening experience, it's crucial to remember that broken heart syndrome is not necessarily a death sentence. It's a serious health condition that requires immediate attention, but with the right care, most people make a full recovery. While it may sound alarming, broken heart syndrome is not necessarily a death sentence, but what can we do about it? Just as a broken heart can be caused, it can also be mended. This is an essential truth we must remember when dealing with broken heart syndrome, a condition that is as real as it is metaphorically named. The first step to recovery is immediate medical attention. Time is of the essence here, as the longer the heart remains strained, the higher the risk of serious complications. Once under medical care, treatment typically involves a variety of medications. These are designed to lower blood pressure, slow the heart rate, and prevent blood clots, all crucial in relieving the heart's distress and promoting recovery. But the treatment doesn't end there. In fact, we might say that the true healing begins after the initial crisis. This is where stress management comes into play. Engaging in regular physical activity, practicing mindfulness, and maintaining a balanced diet can all help manage stress levels and promote heart health. Therapy also plays a significant role in preventing future episodes. Working with a psychologist or a counselor can provide valuable coping mechanisms and strategies to handle emotional stress, thus mitigating the risk of a recurrent episode of broken heart syndrome. In conclusion, we must remember that while a broken heart, both literal and metaphorical, can be a painful experience, it is not a permanent one. With the right treatment, stress management, and therapy, healing is not just possible, it's probable. With proper care and management, a broken heart can indeed heal. So, can a heart really break? The answer is a resounding yes. We've delved into the reality of broken heart syndrome, a condition born out of intense emotional stress. It's not just a metaphor, but a real physical ailment with potentially serious consequences. However, the silver lining here is that it's treatable. Like any other heart condition, it requires medical attention and self-care. Remember, the heart is a resilient organ, capable of healing even when broken. Take care of yours, both emotionally and physically.